Okay. Hi guys. Hi. This is Eva from Bay Harbor Med Spa, Miami and Atlanta. It's Labor Day weekend. And today I want to talk about a very, very interesting subject to all the women that suffer from unwanted facial hair and suffer from hormonal imbalance. Uh, so let's just wait a couple of minutes and then see what we can get and who is coming. Hi, I can see somebody's there. Thank you. Hi. Please, let's just wait for a few more people to join us and to listen, because I think that every woman that suffers from unwanted facial hair and suffers from hormonal imbalance such as PCOS or endometriosis or anything like this needs to hear this, because there are so many questions that are sort of unanswered. And if you don't come to see me personally and you are just searching, you will never get this information. So I'm just trying to see if, hi, if there are any people joining us. I'm also on Instagram Live. So first of all, let me wish everybody a happy holiday weekend. And I will start, because I see there are already a few people here. So I will start my conversation, and the topic is going to be why women that suffer from hormonal imbalances such as PCOS, endometriosis, thyroid condition, Hashimoto disease, diabetes, Cushing's disease, excessive or free floating testosterone that's elevated, why all these women do suffer from excessive hair growth, and why they require more laser hair removal treatments than regular people that just have hairs because they have hairs from heredity, or they have hairs because they just have few hairs. So this is guys, this is a topic that's absolutely super important for people to understand, because so many times people come to me and they don't understand when they ask, or they call me and they say, Eva, how many laser treatments will I need to get rid of my hairs? And Mike, I always ask questions, and whether I ask you questions on the computer or via the telephone, or I ask you questions in person, the questions are very important, because these questions will lead me to give you the correct answer. But the first reason that everybody has to understand why women that suffer from hormonal imbalances have excessive facial hair and require more laser hair removal treatments than any other person is for this simple reason. And I will go a little bit in detail so you have a little bit of a better explanation. I will be a teacher for 2 minutes. So every human being, when we are in our mother's bellies, we all, hi Praline, we all have on our square inch of skin, we all have 1,000 hair follicles. 1,000 hair follicles, okay? These hair follicles are not all active. So I will give you an example so you understand what I mean by that. So I am not hairy, and therefore I had very little hair. So maybe on my legs, maybe on a square inch, I had 30 hair follicles that were active. On my face, I had 0 hair follicles active, because I didn't have a hormonal imbalance and I didn't have any hairs. Turn this around, my daughter, who suffers from hormonal imbalance, PCOS, endometriosis, Hashimoto disease, had 18 surgeries, lost 70% of her organs, was hairy from the forehead to her toes. She has at least, she's now a little bit older, she had at least, I would say on her face, at least 300 hair follicles on a square inch, particularly on this area, that were active. And she, on her legs, had maybe 500 hair follicles that were active. On her belly, maybe she had 400 hair follicles per square inch that were active. On her lower back, she had maybe 500 follicles that were active. On her back, she had follicles that were active. On her arms. So there were many follicles that were active, and this is something that everybody has to understand how this actually works. So human hair, every human hair, whether it's on your head or it's on your pubis, underarms, or on your face, every human hair is connected to blood vessels. There are two blood vessels that connect into each hair follicle. These blood vessels carry blood, and in this blood they carry oxygen, nutrition, and hormones. Bingo! Here is the problem. So when you have hormonal imbalance, which means you have polycystic ovarian syndrome, you have thyroid condition, you have diabetes, you have endometriosis, you have hormonal imbalances, whatever it be, you are producing more androgen, you are producing more male hormones, you are producing more testosterone, and your blood that goes into every hair follicle stimulates all the 1,000 dormant hair follicles and starts to wake them up. Once it wakes up the hair follicles, somebody might have 300, somebody might have 500, somebody might have 50, somebody might have 800. So let's say on average, Middle Eastern men are usually very, very hairy and have dark hair on their face. So a Middle Eastern man will have maybe 500 follicles active on his face. Normal. Turkish men are hairy like bears. Most Turkish men have hair, they really look like covered bears. So they have high levels of testosterone and they are very, very hairy. They really look like bears. Every Turkish man that I've ever treated, they were all like bears. A lot of hair follicles. Now, that's normal for men, but that's not normal for women. And this is where the imbalance of hormones comes. So now when you as a woman suffer from PCOS, that means you have a hormonal imbalance, because the PCOS is Polycystic Ovarian Syndrome. But the Polycystic Ovarian Syndrome is related to your reproductive organs and to your hormones. Remember, elevated hormones has to be testosterone. So just for the sake of our conversation, men and women have progesterone, estrogen, testosterone. Dominant hormone in men is testosterone. The testosterone makes their hair grow and makes their penis work. That's what testosterone does for men. In women, it's estrogen and progesterone, which is a dominant hormone. But P.S., men have also progesterone, estrogen, but with very low levels. Now, if you say, oh, Eva, how is that possible? Have you ever seen a man that has breasts? Maybe not big breasts like mine, but breasts that would be a size A or a size B. Those men have elevated female hormones, and they grow some breasts. So hormones are, if they are in balance, then for male hormones it's testosterone, which is the dominant, and for women it's the progesterone and estrogen. But when hormones are imbalanced, which means when you have hormonal imbalance as a male, as a female, and your testosterone is elevated, your testosterone stimulates the hair follicles that are dormant, the 1,000 hair follicles. And suddenly you get 200, 300, 400 hair follicles that start growing because they are stimulated by the blood flow that feeds them with the hormones. They are stimulated by it. So this is when the difference comes in. Let's say today, today guys, so I am going to be, in 5 months I'm going to be 70. So at 70, I am entitled to have some facial hair. As you get older, you get some hair. So I probably have like 3 hairs on my upper lip now that I'm getting, because I have a little imbalance, and I have probably a little bit more elevated testosterone. But for me, it's fine because I take bioidentical hormone replacement therapy. I take testosterone, progesterone, estrogen, and we can get to that later. So maybe because I do take testosterone, because once I finish with my periods and I go into the stage of menopause, which is for the rest of your life, I personally wanted to have my hormones somewhere where I was about 45, and that's what I achieved. And I do this for I think 15, 18 years. I take bioidentical hormone replacement therapy. So let's say because I do, I don't have facial hair, but maybe I have 2 or 3 hairs on my upper lip, because maybe because I am taking testosterone, I'm taking progesterone, I'm taking estrogen. So because I take them, my hormones are working, so I get few hairs. Now, what happens to a woman? What happens to a woman that has hormonal imbalance, that has PCOS? Excuse me, it's very hot and very humid where I am. So listen to this. This is what happens to a woman. So a woman that has PCOS has imbalance of hormones, and testosterone is very high. When testosterone is very high, testosterone stimulates her hair follicles. Remember what I said. I maybe have 3 hair follicles. My daughter, because she had PCOS, endometriosis, Hashimoto, everything in the book, my daughter had, and she was very hairy. Like, she was actually hairy from the forehead to her toes. I laser her toes because she had hairs on her toes as well. She had hairs like unimaginable. Her whole body was covered with hair because she has hormonal imbalance. So I needed to do on my daughter many, many laser treatments because she had constantly hormones that were stimulating. Remember, I said we have 1,000 hair follicles. And anytime any of the 1,000 hair follicles can be active, and if you have PCOS or you have any other hormonal imbalance, you have elevated testosterone, you can have 500, 600, 300, 200, 700 hair follicles that are active. So when you come to me for laser hair removal, let's say you come to me in Atlanta or you come to me in Miami Beach, and I do laser hair removal on you. So if you come to me and you are somebody like myself that it's just a little bit of hair, genetically, heredity, my grandmother, so I have some hairs. So I will tell you, you need to buy a series of 12 treatments, and we will do laser hair removal for 12 times, and perhaps, by 12 times it will be about 80% finished, done. So maybe you need 15, 16 treatments, and we are completely done. And you don't pay more. You just pay for 12 treatments, and I do the rest of the treatments for free. But if you come to me, or if you call me up, and this is what happens 10 times a day, when people call me, women call me, and say, Miss Eva, okay, I am a black woman, I have facial hair, how long will it take until my hair goes? How many treatments do I need? And then I ask questions. And it's then very clear to me that it is due to hormonal imbalance. So induced hormones, induced testosterone. And then I say, I cannot tell you. I can tell you categorically that you will require more than 12 treatments, because you are constantly stimulating, your blood is constantly feeding new hair follicles. So I can tell you categorically that I treated women that had PCOS, that had endometriosis, and they came for 45 or 50 times until eventually I got the upper hand and we finished, and they no longer have hair. But it took us 5 years until we got to the point that today they have no hair. This is a very, very important thing that all women that have unwanted hair and have hormonal imbalance have to understand. It is not me, it is not a machine. It is your own biology, your own anatomy that causes unwanted hair I thought it was raining, that causes unwanted hair to grow and unwanted hair to be stimulated constantly. So the follicles, as I said, remember again, we have 1,000 hair follicles on a square inch of skin. Under normal circumstances, there will maybe maximum 10% of your hair follicles will be active under normal circumstances. But when you have hormonal imbalance, you will have 300, 400, 500, 600, 700 hair follicles that are active. And they don't all come out on Monday and go to sleep on Friday. That's another thing that people have to understand. When you do laser hair removal, it's a process. It's not a hocus pocus. It's not a one-time treatment or two-time treatment when we are done, because I now killed all your hairs. Absolutely not. You know, hair is actually a science. And if you love your job exactly how I love it, and the reason I love my work is, first of all, I love laser hair removal and I love helping people because I have a daughter. My daughter is today 48 years of age. And I suffered with my daughter since she was 14. And she's my only child. And I suffered with her through hell and back because she suffered. She had PCOS, and then it sort of graduated, and it was a very bad situation. And she got the worst case, PCOS and then endometriosis. And this is something that you all need to understand, that this is not a joke. And because it's windy, that my daughter suffered so much, and I did everything in my power to help her. So not only did she suffer from the conditions and the pain and 18 surgeries and misery and no children and all of the above, but she also suffered with hair. And so I have tremendous amount of empathy for every woman that suffers from unwanted facial hair. I know, because I'm a woman, I'm not an alien. I am a woman, even though I am a professional and I'm in the skincare field and I know so much, but I'm still a human being. I'm still a woman. I don't want to walk around with facial hair, and I have no facial hair. And if I have 3 hairs, I will make sure that I get rid of them and I do electrolysis or laser. However, I understand every woman that comes to see me or calls me up that doesn't want any hair. And so I have tremendous amount of empathy when I speak about this subject, when I treat women, when I preach, when I explain, and when I say listen, just listen. Facial hair is such a thing for women. It is so debilitating. It is so embarrassing. It is such a horrible thing. Women, it destroys people's life. And if you say, oh, Eva, how can that be? Because you don't have any hair. I'll tell you how that can be. A woman that doesn't have the resources, or a woman that doesn't know where to go, or whatever the situation be, and she has facial hair, and let's say you're a black woman, because I specialize in black skin. Of course, I treat white skin, but I specialize in black skin. And she has facial hair, and she has to shave every day. But before she shaves, because people told her shaving is no good, so she tweezes, she shreds, she plucks her hair. And then she gets ingrown, and she gets discoloration, she gets bumps. And this only gets worse and worse and worse, because when you waxing your hair, when you tweezing your hair, when you shredding your hair, you're only stimulating more hair growth, just so you understand that. So you are creating more of a problem in the area of your hair. Now, if you shaved every morning, now the situation is that many of you have to shave at 2 o'clock again or 3 o'clock because you have a 5 o'clock shadow. And because if you go to work, you cannot go and shave, take a break and go and shave. It's embarrassing. So you put this much makeup, foundation to cover up what you have. So not only do you have a problem with hair, not only do you have a problem with ingrown hair, with bumps, with discoloration, now you are clogging your skin up. Now you are putting a ton of makeup because you don't want anybody to see. And I want to ask every woman here, how many women do you know that will tell you that they kissed a man, or that men actually don't care if they kiss a woman or they have sex with a woman and they touch a woman's face and she's all prickly and she has hair on her face? How many of you know of such women, of such men? Ladies and gentlemen, I do this over 40 years before I came to America. I have tremendous amount of experience. I treat women and I treat men. I treat people from all walks of life. And I talk to people because I'm not shy. And I can tell you categorically, there is not one man that I ever met in my life or that I ever met in my clinic that would say, oh, it doesn't matter to me. A woman can have a beard. I can feel it. Doesn't happen. And women know this. So when I tell you that unwanted hair are debilitating, and this is why I tried so much to put outside information and educate people and let people know that when you have excessive hair growth, the worst thing you can do is pluck, wax, thread, or use depilatory creams. This is the worst thing that you can do. The best thing that you can do for your skin, if you absolutely cannot afford, for whatever reason, if you cannot afford to go and get laser hair removal, if you cannot afford that, then here is what I would suggest. I'm giving you a simple recipe. It's not a solution, permanent solution, but it's a solution for now. I want you to go to the drugstore and I want you to buy a razor that has five blades in it. So the razor has 5 blades and they are laid diagonally like this. So they start and then go down. This. And then I want you to buy a bottle of hair conditioner. And I want you, if you have excessive hair growth and you really cannot afford to do laser, although I think any woman can find a way to pay for laser hair removal. Where there is a will, there is a way. But let's say you can't. Then I want you to buy the hair conditioner. And every day that you shave, I want you to take 5 minutes by yourself in the bathroom. I want you to put warm water on your face, particularly, so let's say you take a washcloth, put it in hot water, put the washcloth on your face, hold it several times so you make the face warm, the pores open, and the hair follicle absorbs some of the water. And when that happens, when the hair follicle absorbs some of the water, you are expanding the hair. It becomes a little bit bigger. Then you put hair conditioner on the area where you have hair. And then you shave with the 5-blade razor. And you can do this every day. And you will say, Eva, why do I have to put hair conditioner? I'll tell you why. I will ask you a question. Why do you put hair conditioner on your hair after you shampoo your hair? It's obvious, because we want to make the hair soft and we want to be able to comb our hair. But that's exactly what the hair conditioner does for your hair, for your facial hair. It plumps the hair up, the hot water that you put on plumps the hair up, and then the hair conditioner makes it soft. And then when you shave with the 5-blade razor, it cuts it in a diagonal way. So when the hair comes out, it doesn't come out like this, like a tube straight up. It comes out pointy, not tubular, but pointy. And pointy means that the hair is soft when it comes out. So it's not like a tube, it's not prickly. It's soft because you use the 5-blade razors. Oh, my day joint, high. So that is very, very important that you do. And so the hair conditioner, 5-blade razor, and warm water with a washcloth every day. The same thing I tell you to do if you come for laser hair removal. I tell everybody, so when I see you the first time, and whether you have a lot of facial hair or you have a little bit of facial hair, whatever it is, When you come to me, I advise you to use the same method. I say buy a hair conditioner, buy 5 blade razors, and you shave your hair. So let's say you came to me and you have a lot of facial hair. You suffer from PCOS, from endometriosis. You have a lot of facial hair. So what we actually do when I do laser hair removal on you, I laser. Let's say you lower face or you full face. I laser everything from A to Z when you come for laser hair removal. But here is what you need to understand. I only care, and again, it's not because of me or because of the laser. It is because of the anatomy and biology of human hair. And human hair grows in cycles and in stages. So every time you come for laser hair removal and you don't have PCOS, you don't have hormonal imbalance, you don't have any of those problems, you just have regular hair growth, genetic, heredity, grandmother had hair, so you have some hair, or you have just a little bit elevated testosterone, your hair will require a series of 12 treatments. The treatments are done once every 5 weeks. So what do you do between the 5 weeks and what do you do when you come for laser hair removal? So when you come for your treatment, initial treatment, you must be shaved. You cannot have any hair on the face. So when you have, this camera is going in and out dark because I'm sitting, I think, under the roof. When you come for laser, you shave your hair. You come because you cannot have any hairs on the skin. Why can't you have hairs on the skin? Excuse me, I remove it. Maybe there will be better light because I see it going in and out dark, and I'm on another phone. Okay, so why do you have to shave the hair before you go for laser hair removal? Here's the reason. Laser is a calibrated beam of laser, and the laser itself is only this long. Okay, so let's say I enlarge it and I say like this long is the laser beam. Now, if you have hair that sticks out, if this is your skin and your hair sticks out here, what happens, because the laser is only this long, right guys, only this long, laser will burn this hair that's on the surface and will only go here, but it has to go down here where my finger is, down here, because this is the length of your hair under your skin, and this is where the blood vessels are. But because there was hair outside already, the laser is no any longer than this. It will never go down here. It will only go because it already burned the hair on the surface. This is why before laser, everybody must shave. When you go for laser appointments, you cannot have any hair on the surface because you're wasting money and you're wasting my time. Hi, Ellie Money. Hi, honey. You're wasting my time. So, you must shave the hair before you come. And I always explain to women, and I say, thank you for the hearts. And I always explain, Elijah, thank you. And I always explain to women, you do not ever have to walk with a hair on your face. Thank you for the heart, sweetheart. On your face, I tell you why. Because if you must shave for me, then shave for yourself. You shave for me because I cannot have any hairs. So if you shave a day, hi, merci, okay, merci beaucoup, okay, you're welcome. So you must shave the hair, and you never have to walk around with the hair when you start laser hair removal. So in principle, from the moment that you start doing laser hair removal, you never have to walk around with facial hair, because for the laser treatment you must be shaved. So you shave yourself during the period of the 5 weeks between laser hair removal. The same thing goes for women with PCOS. The same thing goes for women that suffer from hormonal imbalance. All the women that have PCOS, endometriosis, Hashimoto disease, hormonal imbalances, that have excessive hair growth, that have a beard, that have a mustache, they also, which is a wonderful thing, they also must shave because they shave for me, and they also can only come every 5 weeks for laser hair removal. So you shave for me, then you shave for yourself. So you never have to walk around with hairs. But you don't wax, you don't twist, you don't thread, you don't pull it in any other form. You only shave. And you shave with a 5-blade razor, and you shave with a hair conditioner. That is super, super important. And if you have to shave every day, then you shave every day. Then you do it every day. But your hair that is growing out will grow like, like when you go to the hairdresser, and the hairdresser either can cut your hair caress straight like this, or they cut the hair in an angle. Well, that's what I'm talking about. The hair that you shave, you're cutting them at an angle, so when they peek out and when they come out the next day or 2 or 3 days later, they'll be pointy. They will not be like a tube. So that's the way to remove the hair. On a daily basis or in between treatments, or however often you are doing this, this is how you have to remove the hair. Hair conditioner and a 5-blade razor. Now, going back to that same subject that I started with, because I see people coming and going, how many treatments the woman that has hormonal imbalance requires, that depends on her condition. So I always say, I ask a lot of questions. Some people get annoyed by my questions, but only when I ask questions and then I pull out information from patients and clients that they don't even think is relevant. It's like, I ask you, okay, how is your period? Is your period regular? Do you have heavy bleeding? Do you have blood clots? Do you have irregular period? When was your last period? This is very important because that is an indication. Do you have hair from your umbilical cord going straight down to the pubis? Do you have hair on your lower back growing across like this? Do you have hair around on your breast or on your chest or around your nipple? These are all signs of hormonal imbalance. And I ask a million questions because only from the questions that I ask and my experience, obviously, only from this I can then give you a summarized information and say, okay, you suffer, thank you for the heart, you suffer from a hormonal imbalance, you have Hashimoto's disease, or you have diabetes, or you have PCOS, or you have Cushing's disease. And then what I suggest always is to go and see an endocrinologist to find out, or a gynecologist that specializes in this, and to find out then if indeed they do your hormonal test, what your hormone test says. And when they find out what your hormone levels are, a good gynecologist, a good endocrinologist can make recommendations with medication, with tablets, to regulate the problem that you have. And just remember, sometimes you have Hashimoto's disease, you have a thyroid condition. You take your thyroid medication and suddenly you will have a reduced hair growth. Or they give you birth control because you have elevated XYZ hormones. So it is important to do blood work. It is also important to go to a great endocrinologist so that he can decipher everything about you from your blood work. And then from that, he can then tell you, okay, the picture of your blood work shows me this. Now, this is something that all women that suffer from PCOS and hormonal imbalances have excessive hair growth. Going to the doctor is not going to solve your hair problem that you already have. That's another thing that everybody has to understand. If you already have a hormonal imbalance, and you already have a beard, those hair follicles that are active, those hairs will never stop by themselves because the doctor gave you medications, the doctor gave you birth control, the doctor gave you hormones, the doctor gave you patches, the doctor gave you thyroid condition. Those hair follicles that are active will continue being active. What the medication will do for you is the medication will stop. Let's say, remember we said we have 1,000 hair follicles on a square inch of skin? And you take let's say you have 300 or 500 or 700 that are active. So what the medication will do, let's say you had 500 active hair follicles, but you have another 500 that can become active. The medication will stop the ones that are not active. It will stop those follicles to germinate and to become active and start growing as well. That's what the medication actually is going to do. But the existing hair follicles, which were germinated already, they were stimulated already, they keep growing. The only way to stop those hair follicles is with laser. And that's very important to understand, that because I tell you you need to go to an endocrinologist, it is important to understand that going to the, that going to the endocrinologist, that doing blood work, that getting on medication will stop the future, but the present and the past will continue. Now, why? The only thing I can give you is like a simple example. You know, I'm a woman. I like flowers. I don't have a green thumb, but I know a little bit, about seeds. You put seeds in the ground. These seeds will grow eventually, germinate, and they will make roots, and the seeds will grow, and you grow flowers. Then, let's say, the annuals or summer or whatever, then they go to sleep in the winter. But then in the spring, they will come up again. Why? Because the roots were already germinated, and they will keep growing. But that's the same thing for the hair follicles. They were already germinated. The blood flow already, and the testosterone and the androgens already stimulated the hair follicles, so they are constantly growing. They are active. And the only way to make them inactive, the only way to make them inactive is by doing laser hair removal. Because what physically happens is, this is your pore, this is the laser, down here is the hair. So when the laser beam sees something dark, let's say this is dark, you see this is something dark, that's your hair. That's your hair. Now, at the bottom of the hair, there are two blood vessels that are attached to every hair follicle. So these two blood vessels carry the blood, and the blood carries the oxygen, the hormones, and the food. That's how a hair lives. So human hair grows in cycles and in stages, and a full cycle of you or my hair grows has a stage of 3 months. So in a 3-month cycle, we have 3 stages of hair growth: the growing stage, the in-between, and the sleeping stage. What does that mean? Like, how is this relevant to what I'm saying? I tell you how. Your hair grows from being born to going to sleep 3 months. Then your hair can sleep for 5 months. But to go through the anagen, catagen, and telogen stage, it takes 3 months. But here's something very interesting that I know a lot of people don't know. You can only destroy a hair follicle when it's in the anagen, in the growing stage. So remember, I said 3 months is a full cycle of your hair growth. The anagen stage, which is the growing stage, only lasts 2 weeks out of 3 months. 2 weeks out of 3 months. So what physically happens is, when I do laser and you have here 1,000 hairs, only about 10% or 7% of all these hairs are in the growing stage today when I laser you. So I'm only killing about 70 hairs or 100 hairs at the best. But you have another 900 that are here that I have to kill. So it's a process. This is why when you do laser hair removal, it is not a hocus pocus, a 1, 2, 3. So when people call me and say, Eva, okay, so after how many treatments will I be? No, how many treatments? If you have hormonal imbalance, maybe you will come 30 times, 40 times until we are done. If you have just regular hair growth, let's say like me, it's maybe 15 times, 12 times. Oh, Elijah, that's why you're the only one I trust to do laser, and you always speak the truth. Elijah, I love you so much. Thank you, Gani. P.S. Are you in Atlanta now, or are you at home? So anyhow, thank you, but thank you for the compliment. So this is something that everybody has to understand. So I hope, I'm in Atlanta, okay. I hope that I clarified this for you, that you understand now that if you have hormonal imbalance, you will require many laser treatments because you have elevated testosterone, elevated androgen, whatever it is. And that every time you come for treatment, I only can kill 7 to 10%, not because of me or because of my machine, but because of the anatomy, biology of the human body. You get every 5 weeks, only about 7 to 10% of the hair follicles in the growing stage. That's it. And so, hi Lorraine. And so every time that I laser you, I kill between 7 to 10%. No more. No more. Doesn't exist. And so when people think, because I get like some people call me, somebody called me 2 days ago and they said, oh, I want to do electrolysis. That's something I want to share with you guys because it's also something that so many people don't understand, and they think like, this earrings hurt me. That they think about like things that go hocus pocus. Like I understand that in America, everybody wants everything very fast. Like everything should have been done already yesterday. But you know, with human life, it also takes 9 months to make a baby from beginning to end. You know, and so it takes time. Things do take time. We are only human beings, and we are only flesh and blood, and so we are not robots, not yet, and we are not machines. So a human body, you know, things go. Yes, things go like Elijah said. Everything goes in time. You know, it's a process. It takes time. So some people, because I speak about the fact that I do electrolysis, and some people call me. Excuse me, but I'm hot. Some people call me and they say, "Okay, Eva, how much is thank you for the hearts? How much is for electrolysis?" Yeah, when you rush things, they tend to happen. Angela Face 717. Hi. So here is what happens. The principle for laser hair removal electrolysis for destruction is exactly the same because the anatomy, biology of the hair, anagen, catagen, telogen stage is the same. Nothing changes. It's a method by which we treat hair and destroy hair that is very different. And please, ladies and gentlemen, listen to me, listen to what I tell you and what I advise you, because if I save now 3 people on Instagram and 3 people on YouTube, and I save you from pain and discomfort, I did my job today. Here is something that majority of people don't know, because again, it's not something that education is available. That's not something that they teach. By the way, talking about teaching, I just made, and my course for black skincare, laser or skin treatments is ready. So for all the estheticians, all the people, all the nurses, all the doctors that want to treat black skin and want to learn from me, contact me, and then we will send you the link for the course. But going back to electrolysis, something that I need to explain that everybody has to understand. Electrolysis is a method that was invented like 125 years ago in Europe. What is electrolysis? Electrolysis uses a needle. You have to have a hair outside. The hair has to be at least, I don't know in inches, but the hair has to be about this long, so I can put a tweezer on it and I can hold it. So when you have hairs and you want to get rid of them, I always say that I only, yes, love, we can talk. Give me 5 minutes after I am done, and I will call you because I have your number. So I call you, Elijah. So here is what I want to tell you about electrolysis. So this is the needle, right? And let's assume that you have a hair here, and the hair has to stick out, has to be this big. Then I have to take a needle, and I have to insert the needle, and the needle is the length of your hair follicle under the skin. So I insert the needle, then I press on a foot pedal, and I release heat through the needle. The heat here, if this is my hair, and here the needle came down here, now I released heat. The heat hits here, the hair follicle. If the hair follicle is in the growing stage equals water for 2 weeks, the electrolysis, the heat, will destroy the blood vessels, separate the hair follicle from the blood vessel. I take the needle out, and then I take a tweezer, and then with the tweezer I take the hair out. It is a tedious process. It is a painful process. And if you have black skin, people with black skin require a completely different needle than people with white skin. The needle for black skin is different insofar that the heat is not released from the point of entry. There's no heat here, but the heat is here. But instead the heat being dispersed all the way here, the heat is dispersed only at the tip of the needle, and then it does what it has to do. But what happens is, because all this energy normally would be dispersed, the energy is condensed to here. It hurts 10 times more on black skin than it hurts on white skin. Now, why am I using special needles for black skin? Here's the story. If I used a needle that everybody uses, and the entry point on black skin, remember all this is hot, it burns the entry point. So it would create burns, dots of needle, wherever the needle enters, it would burn it around. So I don't want that. So I have special needles that I get from overseas that are specifically made for black skin. But trust me, please trust me on this one. Because I know, because remember, whatever I do on anybody, I did on myself first. So I know how things hurt. And I happen to have now 3 white hairs. And I do electrolysis to myself. And I have to repeat it, because same way, like I'm explaining you, my hairs is in the growing stage. So until I kill the hair follicle, I have to repeat it. It hurts. And when you have 1,000 hair follicles or 500 hairs, whatever, and I have to sit there and do electrolysis on your hair, you sit there, you lie down, and the tears are coming down your eyes, and after an hour you say, Eva, enough. I can't take it anymore. So I am saying to everybody that listens to me, please, don't wait until your hair is white. Why am I saying white? Laser cannot treat white hair or blonde hair. Laser can treat dark hair, because laser is attracted to the color of the hair. Particularly in black skin, I have special lasers for white skin, special lasers for black skin. But the young laser is attracted to the color of the hair, not the color of the skin. So if you have blonde hair, it's no color. If you have white hair, it's no color. So laser will do zero. So when you have white hairs, I have to do electrolysis. When you have blonde hairs, I have to do electrolysis. Tons and tons and tons of black women come to see me when they already have at least 50-60% of white hairs. And I have no choice. I have to combine. I have to do electrolysis on the white hairs, and I have to do laser on the black hairs. And I should have $1 for every tear that every woman that lies on my table and I do electrolysis on, for every hair, for every insertion of a needle that hurts, tears come down because it hurts. So I am telling you the honest truth. Don't wait until you get white hairs. If you have unwanted hairs, you do everything you can to do laser hair removal. Everything you can to do laser removal. Don't wait until you get white hairs, because I promise you, and guys, I have some posts, I think on Google Maps, I have like reviews or posts that people posted, and on YouTube, I posted some live videos of people that I do electrolysis, live electrolysis, and people speak, and you see the tears are coming down their eyes. But what choice do you have when you have a beard? What choice do you have as a woman? You have a beard, you have white hair. What choice do you have? And you didn't know that Eva existed, or you didn't know that when you had black hairs, you should have done a YAG laser or laser hair removal, depends on your skin color. So it's something that I am sharing with you because I think I can prevent people from, because to me electrolysis is painful, it's torture, and it's unnecessary, right? So if you can, please do laser hair removal. If you are a woman and you have hormonal imbalance and you have excessive hair, don't buy a handbag, don't buy shoes, don't buy fancy stuff, don't buy garbage, don't spend your money on shit. Pardon my French. Put your dollars together. Laser hair removal today is not so expensive. Yes, it costs money, but in the big scheme of things, I give you an example. Let's say you have a full face and neck that I have to do. So you have the sideburns, you have the cheeks, you have the upper lip, you have the chin, and you have the whole neck. So let's say hypothetically, for 12 treatments, you prepaying, it would cost you $3,600, which is $300 per treatment for your whole face and your neck, which is very cheap. But let's say, and you do laser hair removal, and then we eventually are finished, and you will be hairless. So you paid $3,600 to get rid of your hair permanently, and you see me once every 5 weeks. Now listen to this. And you don't pay me a penny more. This is what you pay, and that's it. If you have white hairs, 15 minutes is $50. If I have to sit an hour on you, that's $200. Electrolysis has to be repeat, so let's say you do electrolysis. Correct. Don't spend, don't wait until you have to do electrolysis, because electrolysis, remember that I said for electrolysis your hair has to be out because I have to hold it with my tweezer. So electrolysis you will do every 2 weeks, hypothetically, every 10 days. So every 10 days or every 2 weeks you will pay me $200 to do electrolysis on your white hairs. And you will do this for 30 times or 40 times. Make your math. In my calculation, 10 times 200 is 2,000. 20 times 200 is 4,000. 30 times 200 is 6,000. That's just my calculation. Can you now see how doing laser is much cheaper? Now, I'll give you an example with something that I absolutely say to everybody, don't do that. You go vaccine, because people introduced vaccine in America about 25 years ago, and everybody thinks that vaccine is God's given gift to planet Earth. It's God's given gift if you are white, but not if you are black, and not if you have hormonal imbalance. So I don't know, because I really don't do vaccine. So, but let's say that you go and you do your face, and you have to vax every week. So let's say the upper lip is $25. Let's say you wax, you face, whatever is $70. So $70 every week, or let's say $280 a month. $280 a year. So that's 2,800. That's like 3,000 something dollars. Calculate, and waxing you for the rest of your life. So just take $3,000 and multiply this by 15 years. Do you see now what I am saying? That doing laser hair removal is the cheapest way to go, even if you pay upfront, few extra dollars upfront, but doing laser hair removal with bad bumps, yes, sure. You should never do that, Elijah, never. So when you do laser hair removal, and when you are smart about it, save you money. I have yet to turn anybody away. So if you can come to my Georgia Nuna location, or if you can come to my Miami location, we always have a way to work something out. If, let's say you can't pay me $3,600, so I'll let you pay it out in 2 or 3 times. So we break it. Not the end of the world. But you will be hairless, your skin will be smooth, you will have no ingrown, you will have no bumps, you will have no discoloration. Isn't that worth the effort and the sacrifice of not buying junk and saving money? If guys, I am a big, yes, I stopped vaccine because it was giving me ingrown hairs. So I will tell you something, guys. It's just something from my personal life. Mosquitoes are biting me. I can't say how, I really enjoy coffee. I'm a connoisseur for coffee. I am a very bad cook. My daughter said that if my dogs don't want to eat my food, I don't buy that, but let's say. But I am, when it comes to coffee, I will go into lengths every morning to make my coffee. And I share this for a reason, guys. I can't see without glasses. I share this for a reason. So I make my coffee in a French press. And so I buy coffee, I buy 2 or 3 different grinds of coffee, and then I mix them. I am a feinschmecker for coffee. Every morning, I have a station for where I have my coffee, a container of coffee. I have my grinder, I have my water heater, and I have my French press. So I take 3 soup spoons of coffee, put in my grinder. I grind the coffee, nothing better than fresh smell of coffee. Then I pour the coffee in my French press. I boil water, and the water is hot. Then I pour the water in my French press. I take a spoon, I mix it, and then I put the cover, the plunger on top of it, and I wait 3-4 minutes until the coffee takes all the aroma. And then I push the filter down, and then my coffee is ready. As I don't eat dairy, so I use a 12% soy milk, and I have a frother, a electric operated frother with a spiral at the end. So I take, let's say this is my cup, I put up to here cold almond milk, but it must be 12%. And then I take the frother, 10 seconds, and I froth, and I get big froth from the almond milk. And then I pour my coffee. Guys, in 17 seconds, I will be done on Instagram. So if anybody wants to talk to me, you can move to YouTube, because I'm still on YouTube, or you can email me. Elijah, I will call you when I finish with this. I thank you so very much, and have a wonderful, happy holidays. Done. Okay. So, and then I make my coffee, and I never actually go to Starbucks to buy coffee. But sometimes my daughter likes coffee. She's not a feinschmecker like me, so she's mom, and I buy her coffee. And 2 coffees like $10-12. And they have a language for coffee, like I want a cappuccino, that's it. But like I was laughing with my daughter, I had to memorize 9 words to describe what kind of coffee she wants, but it's all like, it's bullshit, it's a game. But let's say you pay $5 or $6 for coffee. Just think about it. And you buy 2 coffees a day. You buy 1 coffee a day. That's $150 a month. That's $150 a month just for coffee at Starbucks. So give up your coffee. I just gave you a recipe how to make. So if you buy the grinder at Walmart and you buy the French press at Walmart, that will cost you together $30. And then you buy coffee beans. So I buy, whatever you like, dark, whatever. I buy coffee beans. So you have the coffee beans, you grind the coffee beans, and you buy the soy milk 12%, and for $5 you have coffee for the whole week. So just by not buying coffee, you can save up the money to do your laser hair removal. Do you understand that, guys? That's super, super, super important. So this is why I say I don't accept the fact, not for everybody, for majority of women, that say, Eva, I can't afford it, because people buy like junk Coca-Cola or whatever, and you pay $3 for that, and you buy coffee and you spend $15 a day on junk. Don't buy a sandwich in a sandwich place. Make your own sandwich. Go to the supermarket, buy your cold cuts, buy your bread, buy your butter, buy your pepper, buy your cucumber, buy your tomato, buy lettuce. Make sandwiches every day. Take sandwiches. So the sandwich, your lunch is $7. The lunch will cost you $1 if you make it at home. I'm just saying. So $15 a day. That's $450. That's your laser. That's your laser payment. Do you understand what I'm saying? So just exert a little effort, a little common sense, and you can put the money together to do laser hair removal. Guys, I'm going to go now because the mosquitoes are eating me up alive here. If you have any questions, you can call me at 305-864-3333. 305-864-3333. You can also email me to medspa33154@gmail.com. You can email me. I always answer all questions. Might not be the same day, but I always answer everybody's question. So if you have any questions, please call me. If you like the video, if you think what I say makes sense, you can subscribe, share the video with other people. Share it, because I give tremendously valuable information to all of you, okay? Thank you, guys. Thank you. Have a wonderful holiday, everybody. If you're in America, if you're not in America, have a wonderful weekend. Stay safe and peace on earth. Ciao, guys. Eva.